The Women's Health and Wellness Alliance has existed since 1993, 17 years of proud victories that began back in 1993 with passage of the very first law that required coverage for annual women's health exams, including mammograms and pap smears. And in the years since that, we've passed landmark legislation that includes the Breastfeeding in the Workplace bill, one of our major victories from last session that allows women to keep their jobs and breastfeed in those critical first months. And we also passed one of our long-term goals, which was access to birth control for the women of Oregon, requiring coverage for prescription birth control under insurance. This year, we have had a phenomenal participation, and we had so many ideas come forward that we have now introduced 12 pieces of legislation instead of our usual 10, and we could have had many, many more, but we really did restrict it to just the most compelling ideas. So I'm here to tell you about a few of the bills, and then Representative Tomei will tell you about some others, and then we will turn it over to the people who you really want to hear from. The centerpiece of our legislation this year are two bills dealing with low-income women who are breast and cervical cancer victims. We have a great program in Oregon called the Breast and Cervical Cancer Program that covers low-income women who are needing to be screened for breast cancer, and then also covers the treatment for those women that are diagnosed with breast cancer. It's a great program, except that we have so many more women that are eligible for it that we're not covering. In fact, for the breast cancer screening, we are covering really only a small percentage of the women that are eligible. So our proposal would provide screening for 15,000 more low-income women. And the companion bill to that, which is the Breast and Cervical Cancer Treatment Equity Act, is really about basic fairness. The way it works right now is if you are diagnosed with breast cancer under the screening program, your treatment for that breast cancer is also covered by the same program. The problem is many, many women get their breast cancer diagnosis through another provider who may not be part of that program. And simply by that fact, it means that their treatment will not be covered even though they meet all the eligibility requirements. So this proposal will cover 100 breast cancer survivors so that they don't have to delay their treatment. They can get the critical life-saving care, and we know that breast cancer is survivable, but much more so when your diagnosis is an early one and it's followed immediately by the treatment that's needed. This is especially important to me personally because I am a breast cancer survivor. Having been diagnosed in 2005, I was one of the lucky people who had great insurance, had an early diagnosis, and didn't have to worry. But you will shortly be hearing from Michelle about what it's like when you're not in that category and you really need this program that we want to expand. We also are dealing with the ability to prevent cervical cancer. We have a bill that will provide health insurance coverage for the HPV vaccine. We now know and have discovered in the last few years that most cases of cervical cancer are preventable by a series of vaccinations for the human papilloma virus. So this proposal would require health insurance to cover the 3-shot series of the HPV vaccine. That basically means that we can save lives and move toward eradicating cervical cancer in our lifetimes. Third, we have a bill that we call a preventive prescription for partners. This deals with people that are diagnosed with a sexually transmitted disease and gives them the ability to get a prescription for their partner along with the prescription that they get so that they can deal with the ability to make sure that everybody is taken care of and that the disease does not spread or no one gets reinfected. And fourth, we are supporting paid family leave. This is a proposal that was from last legislative session in 2007. We had a bill that passed the House and creates a family leave insurance program that will allow people to take up to 6 weeks of time off after the birth or adoption of a new child, or when a family member is critically ill and needs somebody to be there with them. So this bill will provide for a modest benefit of $300 a week for people that need to be home with a family member, so people will no longer have to make that painful choice between keeping their job and being with a loved one or a newborn when their family needs them.